Mr. Vice Rector, Mr. Dean, colleagues and friends, and especially my friends and colleagues that are listening on the webcast. It's a great honor for me to stand here tonight. Engaging in preparing for my inaugural lecture, it was an opportunity to pause for reflection on my journey to date and my journey in the future. But it was also an opportunity to engage with friends to discuss what I'm going to say at my inaugural. And Yusuf Chikta, as he does, said, "You must profess. I want to hear your story." And on the very same day, in an email conversation with Stuart Menon, he wrote the following: "I envision a couple dancing to the music that for you is the most soothing and healthful. And that dancing couple would be pathology and medical education. You are one, unified, yet separate, dancing in the moment, swaying, feeling each other, responding, being playful and creative. The music is passion and inquiry. The dance represents your life history, and only you can know the steps." So tonight I want to share with you some of my dance steps. So I want you to get out your favorite piece of music, put on your headphones so that you don't bother each other, and let's dance. I'm not going to make each step explicit, but I hope that in hearing your own music while observing my steps and the different dances with various partners, you will adapt the steps to your style and start creating your own dance. For me, this at the heart is a story of my dancing with reflection, role models, mentorship, and learning. And I forgot to drink water beforehand. The title of this inaugural was inspired by Alan Bleakley. Now, Alan Bleakley did research on the UK on learning, and as part of this research, he observed ward rounds. And at one of the ward rounds, there was an intern on the oncology ward round. And those of you who've been interns on oncology know that you don't have a clue. I mean, few people have a clue. Thank God the oncologists do. But this intern was standing, and the pharmacist who just adapted the dosage on the drug chart handed him the chart to pass on to the sister. And instead of passing it on, he took the chart and he took out his pen and he started scrutinizing this chart as if he had a clue. And afterwards I asked him, "Why did you do that?" And he said, "It made me feel genuine, just like a doctor." So he tried to cover up his ignorance and bewilderment by indicating competence and control. Then Alan Bleakley poses this question: who would not wish to shed the skin of the early learner, the apprentice, the junior, as quickly as possible, to assume the identity of the resident in the house of medicine, finding a home for one's professional soul? How can you resist that? Do we ever do this? Fake it or cover it up? I know I do. I often feel like an idiot and try to cover it up, and I'm scared that somebody is going to recognize that I actually don't know. I have experiences like that every day, and I reflect on them. When I drive home in the evening listening to John Mathan, as quite a few of us do, I think about specific aspects of the day. I replay what happened and unpack it. I think about what I did well and where I can improve. And I ask myself why I responded the way I did, what had an impact on me, what am I trying to hide from? And then I think about how to do it better next time. And part of doing it better, of course, is the delicate dance with the literature and finding the evidence to improve my practice. So now that I've introduced evidence-based practice, what does the evidence say about this reflection that I talk about? Reflection is defined as a metacognitive process that creates greater understanding of the self and the situation, with impact on future actions informed by this understanding. And this is a simple enough statement, and we all reflect every day, don't we? So why should we consider reflection as if it has some greater meaning? And I suddenly hear an echo from long past or not so long past. I am a doctor at an academic institution, so I know how to teach. Don't tell me about teaching, I've been doing it for 20 years. And in an academic's life, there is a moment of divine intervention when one is cut by the Vice-Chancellor. We miraculously acquire the ability to teach well. Where is the reflection in that? Continuous-based personal development and evidence-based practice is underpinned by critical reflection. And critical reflection contains quality analysis, interrogation, and reframing that will lead to transformative learning or a shift in perspective. The acquisition of new knowledge or new skills will improve your ability, but it will not impact on your lifelong learning in the same way that critical reflection and wider understanding will. So reflection is a process with purpose. And it works like this. You have current actions. And the first thing that you need to do, as Meserov says, is you need to notice what you are doing. By reframing how you look at it, by interrogating it, analyzing it, and obtaining feedback of your actions. Once you do that, you will develop an increased understanding. And you can apply this new understanding that will result in actions for effective resolution. And then the cycle begins again. And it should be a spiral so that we all always move up. So why not do the following? The next time you make a diagnosis or you come to a conclusion after collecting information, and it can be anything, stop for a moment and perform the following exercise. List your findings in favor of your conclusion. List your findings that is against the conclusions, because often in our decisions there are findings that are against your conclusion. And then also list the findings that you would have liked to see but are not present. And then decide whether you can come to this conclusion or whether you should reconsider your conclusion. Then you've practiced guided reflection. Now, in my dance of life, from my father, I got the steps of inquiry. I mean, curiosity has a new name when it gets to my dad. A love for reasoning and the heated side of my temperament that some of you have seen. From my mother, I get my love for reading, my creativity, and the caring, collaborative side of my nature. Both gave me passion and a love for music and singing, although that I don't do so well, and dancing. I never really had a chance. By the time I was 4, I declared that I wanted to be a doctor. And I know, it had to do with Francois Neetling, our GP, who was a friend of my parents. And I think I'm safe if I say that he was my first professional role model. By the age of 5, I ran away for the first time to the public library. And they phoned my mother and said, if you're looking for your daughter, we have her. By the age of 8, I publicly declared my intention to become a researcher. And I've been thinking about why that was. That was about the time of the first heart transplant. So the word researcher, navorser, definitely featured a lot on the radio and in the newspaper. So I think that might have influenced me because I didn't have a clue. I should have realized also that I was destined to be a teacher when in high school I became a maths and Latin tutor to my friends. But that was because my maths teacher, Mr. Mankies, and my Latin teacher, Mr. Bosman, allowed me to harness and explore my creativity and gave me the freedom to think laterally. I was not taught to. I received feedback and I learned. And I could start practicing the first small steps of the dance of learning. Going to university, I learned the balancing act of student life and academic responsibility the hard way. And I was dancing before I could walk. I take full responsibility for that, but I do wonder whether, if in my first year it was less about listening to droning voice after droning voice and falling asleep in most lectures, especially chemistry, and not physics as well. It would maybe have been different. And the lesson that I learned at that stage, I think, was engage your students.